speaking to you in not very pleasant times. Our country is going through a very, very bad second wave of the Covid-19 pandemic. And I can tell you from what I see in at least our hospitals, the beds are full and people are falling sick very quickly. While this is going on, I have a lot of patients who are calling me about vaccinations. I want to talk to you about two things today. One is, why should one get vaccinated? And the second is, what should a patient with heart disease do or take precautions in terms of getting vaccinated? Number one, there is enough evidence now that suggests that vaccines work. There is enough information that's been put out from the Center for Disease Control, the CDC, an American body, which has analyzed about 87 million people who have been vaccinated since the rollout there in December. And they have looked at how many have actually fallen sick, how many have got hospitalized, how many have died. The interesting thing is that only 77 people out of 87 million have died after getting vaccinated. And this study is about people who are vaccinated. The chances of getting hospitalized is very, very small. The chances of having symptomatic COVID infection is about 1 in 2,000. The chances of getting hospitalized because of a COVID infection is 0.0005%. And the chance of mortality is even lower. Therefore, I think it makes sense, and with the current available data, that everybody should get vaccinated, especially those over 18. Our country is opening up to this in the next couple of days. I urge everyone to please register for this. Get your shot as soon as your turn comes, and this is one of the best ways we can beat the pandemic. And I urge all of you to wear your masks, maintain social distancing, and avoid crowds. Now, coming to the second part of this small video is, what do patients with heart disease need to take care for? Basically, if you are on any cardiac medications or any blood thinners like aspirin or clopidogrel, there is no contraindication to get the vaccine. I repeat, there is no contraindication to get the vaccine. So please go ahead and do that. You need not have to stop any cardiac medicines, especially aspirin or clopidogrel, for you to go ahead and take the vaccine. There is a word of caution that goes around in the social media saying that patients on blood thinners should not take it. Yes, it is partially true. Only those patients who are on vitamin K antagonists like azithromycin or warfarin, again, it is not a contraindication. They also can have it, but I would recommend that they check their INR, which they must be doing regularly anyway. And if the INR values are below 4, you are very safe and you can go ahead and take the vaccine very comfortably with no risk to you or to anybody else. However, if the INR is more than 4, I would suggest you maybe stop the dose for a day or so, let the INR come down below 4, and then go ahead and get your jab. This is the best thing you can do for yourself and for our country. This is the only way we are going to beat this pandemic. Friends, be careful, be safe.